So here we can see our Honorable Vice President of India is interacting with the staff at the counter. And he is visiting the marketplace right now. Those who are still standing, may I humbly request you to kindly be seated. Ladies and gentlemen, please join me in welcoming our Honorable Vice President of India, Shri Jagdeep Dhankhar ji, Honorable Minister of Health and Family Welfare, Government of India, Dr. Mansukh Mandaviya ji, and other dignitaries on the dais. And may I request you all to kindly remain standing in honor of national anthem. May I request you all to kindly rise for the national anthem. May I request you all to kindly be seated. Namaskar, good morning, ladies and gentlemen, and a very warm welcome to all of you in the International Symposium on Health Technology Assessment 2023, organized by Department of Health Research, Ministry of Health and Family Welfare, Government of India, in collaboration with World Health Organization and the Center for Global Development. It is indeed our proud privilege and honor to have the gracious presence of our Honorable Vice President of India. We are extremely pleased to have with us the Honorable Minister of Health and Family Welfare, Government of India, Dr. Mansukh Mandaviya ji, Member, Niti Aayog, Government of India, respected Professor V.K. Paul ji, Secretary, Department of Health Research, Government of India, and Director General, Indian Council of Medical Research, respected Dr. Rajiv Bahel ji, respected Mr. Sunil Kumar Gupta, Secretary to Honorable Vice President of India, respected Dr. Rodrigo Offring, WHO Representative to India, respected Dr. Javier Guzman, Director, Center for Global Development. We also extend a hearty welcome to the ambassadors, representatives, and delegates from various countries, guests from WHO and the Center for Global Development, officials from different departments and ministries, and all other dignitaries and esteemed guests present here. We welcome you all in our today's International Symposium. And may I now humbly request Honorable Vice President of India to kindly light the lamp and inaugurate today's program. Sir, please. Thank you, Honorable Vice President, sir, and Honorable Union Minister, sir. Ladies and gentlemen, this year, in the second International Symposium on Health Technology Assessment, focus is on affordability, availability, and accessibility of healthcare technologies through evidence generated by health technology assessment for universal health coverage. And now for welcome remarks, may I invite Joint Secretary, Department of Health Research, Ministry of Health and Family Welfare, Government of India, respected Srimati Anu Nagarji, please.
Honorable Vice President of India, Shri Jagdeep Dhankhar ji, Honorable Minister of Health and Family Welfare and Minister of Chemicals and Fertilizers, Dr. Mansukh Mandaviya ji, Member Health Niti Aayog, Professor Vinod Paul, Secretary to the Vice President of India, Shri Sunil Gupta ji, Secretary, Department of Health Research, Dr. Rajiv Bahel ji, distinguished guests, speakers, and participants. On behalf of the Department of Health Research, Ministry of Health and Family Welfare, it is my proud privilege to welcome our chief guest, Honorable Vice President of India, Shri Jagdeep Dhankhar ji. Sir, we are honored by your gracious presence and grateful that you have accepted our invitation. Today, we are looking forward to gain from your rich and varied experience and words of wisdom. I warmly welcome our leader, mentor, and guide, Honorable Minister of Health and Family Welfare and Minister of Chemicals and Fertilizers, Dr. Mansukh Mandaviya ji. Sir, we are deeply honored by your august presence. I welcome the Chairman of Medical Technology Assessment Board and Member Health, Niti Aayog, Professor Vinod Paul, sir. I also welcome Secretary to the Vice President of India, Shri Sunil Kumar ji, and Secretary, Department of Health Research, Dr. Rajiv Bahel in this session. I warmly welcome His Excellency, Mr. Joara, High Commissioner, Republic of Gambia, Her Excellency, Mrs. Akushe, His Excellency, Mr. Sehe, from State of Eritrea, His Excellency, Mr. Kulomu, from Kingdom of Lesotho, His Excellency Mr. Ravanga from Burundi. I also welcome Mr. Edem from Togo. I also welcome Dr. Balram Bhargar, our ex-Secretary NDG. I welcome all the members of press and media and all the esteemed guests and participants of this symposium. Ladies and gentlemen, the Government of India, through its various initiatives, is committed to improve the healthcare delivery in the country. In addition to many flagship schemes, we not only run the largest assurance scheme in the world, the Ayushman Bharat Pradhan Mantri Jan Arogya Yojana, but the country also has the distinction of 60% of world's vaccine production. We have a medical devices industry which is fourth largest in Asia and has a potential to be valued at $50 billion by 2030. In the recent budget webinar of health and medical research, our Honorable Minister, Dr. Mansukh Mandaviya, had emphasized that apart from volume, it is also necessary that we give due focus to the value of our services. Sir, health technology assessment is one such mechanism which maximizes value gain for every rupee spent in the healthcare system. It is a robust scientific methodology which assesses both clinical and cost effectiveness of health interventions and technologies. It provides evidence for their quality and cost effectiveness for an informed decision making. Health Technology Assessment, a program of Department of Health Research, was introduced in 2017. It is headed by a Medical Technology Assessment Board. We have 18 resource centers and technical partners spread across the country. Sir, all of them are represented here today. One of our greatest successes has been in providing a baseline for costing of about 1,300 health benefit packages of Ayushman Bharat Pradhan Mantri Jan Arogya Yojana. ISHTA has also helped the health departments, both central and state, to introduce new indigenous health technologies and innovative diagnostic kits, including digital devices. We are sure that benchmarking of ISHTA to these medical products and technologies will increase their market credibility both inside and outside the country and boost the Atmanirbhar mission of Government of India. Apart from value addition to various health interventions and guidelines by making them more cost effective, ISHTA has also helped the health programs of the department by providing them cost effectiveness threshold and thus helping in procurement. This symposium, attended by participants from 27 countries, gives us an insight on the best practices in ISHTA followed worldwide. It also provides us an opportunity to showcase the strides India has undertaken for quality and affordable healthcare. We also strive to strengthen collaboration with more countries on ISHTA. Sir, today we have representation of academia, the researchers, the implementers, and industry in this symposium. With this background, I again welcome our chief guest, Honorable Vice President of India, Shri Jagdeep Dhankhar ji, Honorable Minister of Health and Family Welfare, and Minister of Chemicals and Fertilizers, Dr. Mansukh Mandaviya ji, Member Health Niti Ayog, Professor Vinod Kumar Paul, our distinguished guests, and all the esteemed participants of this symposium. Thank you.
Thank you, Ms. Anu Nagarji, Joint Secretary, Department of Health Research, Government of India, for the opening remarks. And now, ladies and gentlemen, we present a short video on the journey of health technology assessment in India.
The Indian healthcare system serves over 1.4 billion people. To ensure access to quality and affordable healthcare, the Government of India, under the leadership of the Honorable Prime Minister, has launched several programs like Ayushman Bharat Infrastructure Mission, Pradhan Mantri Jan Arogya Yojana, and Health and Wellness Centers. To maximize the value for every rupee spent on healthcare services, the Department of Health Research, under the Ministry of Health and Family Welfare, has established the Medical Technology Assessment Board and Health Technology Assessment in the Indian ecosystem. Health technology assessment is a process to determine the cost effectiveness and clinical effectiveness of health technologies such as diagnostic tests, devices, drugs, procedures, or health programs. The purpose is to inform evidence-based policy decisions and promote a patient-centered, affordable and high-quality health system. ISHTA-IN has 18 resource centers and 10 technical partners across India synthesizing evidence. It has provided more than 42 policy briefs with recommendations for central and state governments and published more than 100 research articles. One of the largest nationwide ISHTA-IN study resulted in price revision of Ayushman Bharat Pradhan Mantri Jan Arogya Yojana health benefit packages using cost data collected across public and private hospitals. As a result, India is now developing its own National Health System Cost Database. To prevent the spread of HIV and other diseases through the unsafe use of syringes, state governments have procured safety-engineered syringes at negotiated prices based on ISHTA-IN recommendations. Similarly, ISHTA-IN recommendations help the Ministry of Health to provide the cost-effectiveness threshold for point-of-care screening test for sickle cell disease. For a TB Mukt Bharat, state governments have implemented devices to monitor TB treatment and molecular TB diagnosis. Contributing to Atmanirbhar Bharat, indigenously developed efficient health technologies are being promoted by ISHTA-IN, like hearing screening devices and resuscitators for newborns. ISHTA recommendations have been instrumental for framing cost-effective guidelines for cervical and oral cancer screening. ISHTA-IN provides policymakers with budget impact analysis to assist financial planning and rollout. ISHTA is a powerful tool in providing affordable, accessible, available and quality health technologies for achieving universal health coverage. ISHTA-IN will ensure that India is ready to face the challenges of tomorrow and protect the lives of billions. It is health that is the real wealth and not pieces of gold and silver.
So, ladies and gentlemen, after this video, may I now request respected Dr. Rajeev Bahel, Secretary, Department of Health Research, Ministry of Health and Family Welfare, Government of India, and Director General, Indian Council of Medical Research, to kindly deliver his address.
Honorable Vice President of India, Shri Jagdeep Dhankhar ji, Honorable Minister of Health and Family Welfare and Minister for Fertilizers and Chemicals, Dr. Mansukh Mandaviya ji, Honorable Member Niti Aayog, Professor V.K. Paul ji, Shri Sunil Kumar Gupta, Secretary to the Vice President of India, all the distinguished guests and colleagues. As you saw in this very short video, the role of health technology assessment has been expanding, not only in the developed world, but also in the developing countries. In fact, I would say it is much more important for low and middle income countries where resources are they are more limited, that we use the resources to the best effect. Technologies are ever expanding, and sometimes we will even get an overdose of technology. There will be alternatives, there will be newer technologies, some of which will be more appropriate than others, and some will be more cost-effective than others. And in addition to knowing the efficacy of these technologies, it is extremely important to know that under what circumstances they should be used, where they are appropriate, what is useful at a health and wellness center or a PHC or in a district hospital versus a tertiary care hospital. And at what cost would this be effective? While not compromising the quality, that is one thing that I want to highlight, that low cost does not mean poor quality. We have to maintain the quality and yet do it at an affordable and accessible cost. And in this, using the best scientific knowledge, using the best evidence of both effectiveness, costs, and appropriateness, if we do it in this rigorous scientific way, the health technology assessment, as you saw in that brief video, can be a very powerful tool for us to move forward. The Ayushman Bharat PMJ is the largest health insurance or assurance scheme in the world, fully financed by the government. And I think this is one of the greatest strides towards universal health care that I have ever seen. Even when I was working at WHO, we were so proud to see that what progress India made in just making the Ayushman Bharat PMJ scheme cover 50% of India's poorest population is phenomenal. And the way the HTA, you might have gone to the marketplace and seen the way the HTA has benefited the Ayushman Bharat by putting in the best packages. What is the cost of those health packages? What are these technologies that we can bring? For example, universal auditory screening, I'll just give one example, is such a simple thing to prevent children from becoming disabled if we are able to capture them early in life and treat them. And if we have the technology, we do have those technologies, now we have indigenous technology to make it happen. And this is what gives great promise. HTA India, I'm very proud to say, will not be any pilot program anymore, but will be a permanent office in the Department of Health Research moving forward, with a dedicated team and resource centers all across the country. Our goal is to make this accessible technology, as our Honorable Vice President, the first thing he said is, will it be available in my village? And I think that is the right question, that we have to make these technologies available, working for every Indian citizen, no matter where they live, no matter where they stay. So I really welcome again all of you. I add my welcome and look forward to the discussions in this symposium, where we will be sharing the experiences on health technology assessment from many countries across the world, and look forward to the deliberations. Thank you very much.
Thank you, Dr. Rajeev Bahelji, Secretary, Department of Health Research, Ministry of Health and Family Welfare, Government of India, for your address. And now, ladies and gentlemen, I would request Member Niti Aayog, Government of India, respected Professor V.K. Paulji, to share his perspective on the International Symposium. Sir.
Thank you. Good morning. Namaste. Honorable Vice President of India, Shri Jagdeep Dhankhar ji, Honorable Union Minister of Health and Family Welfare and Chemicals and Fertilizers, Dr. Mansukh Mandaviya ji, Secretary Shri Sunil Gupta ji, Secretary DHR, Dr. Rajeev Bahelji ji, distinguished invitees from abroad, Excellencies, our distinguished participants from the World Health Organization and other global organizations in the room, Professor Balram Bhargav, dear scientists, entrepreneurs, and Team HTA in DHR, good morning. I'm honored to be here to take part in this session heralding the International Symposium on HTA. I'm very proud that I have been associated with this organization for a considerable amount of time, and I'm so happy that the organization is now, from toddler years, is moving into late childhood years. We can see the great achievements that's already making, the waves it is making, the publications it has, the policy briefs it has generated, and I'm particularly proud on two aspects. One, our network of scientists who will perform the tasks in the rubric of HTA is increasing. We have presence in 18 centers and many more should come. Second, we are responding to the needs of the state governments, which is absolutely remarkable. Ultimately, for a vast nation that we are part of, we need assessments and decisions that are relevant to the individual context, including the states and, in fact, at the sub-state level. And therefore, participation, ownership of the states and to be able to respond to those needs is another highlight that's emerged on the scene in this journey so far. Sir, strong health systems require strong institutions. A health system stands on many pillars of institutions. And under the leadership of the Honorable Prime Minister, our nation is moving toward a very strong, resilient health system for New India, and particularly, we are witnessing an acceleration during the Amrit Kaal. So we need the National Disease Control Center for Disease Control. We need the new AIMSs, many AIMSs, so that they show as centers of excellence. We need ICMR network of laboratories. We need the National Institute of Virology. We need other institutions. But, sir, one such institution which is a must as we move toward a strong, sensible, evidence-driven healthcare system is the Health Technology Assessment System. And that's what we celebrate today, the journey so far and the vision further on. Through ISHTA, we make evidence-informed choices. So we have always said we need more money for health, and we'll continue to say so to our leadership. But at the same time, it is our responsibility, and many of us, those who are responsible for this, are in this room, is to be able to provide the best and the highest possible health out of the resources that are available. The resources for health are never infinite. They are finite. We need more of that. But at the same time, whatever resources are put on the table must be spent for the best possible outcome that we can accrue out of them. And that's where ISHTA comes in. It allows us to make decisions at the macro level in the public health paradigm and the clinical paradigm as well. And we must remember that we still suffer from a very significant problem of out-of-pocket expense to the tune of 48%. If we don't take rational decisions on affordability through a systematic process, and that is what ISHTA does, we will not be able to address this problem systematically and efficiently and address it in the near future. Therefore, for universal health coverage paradigm to move forward, such decisions, systematic decisions, are important. Sir, ISHTA is also a tool in our hand to promote equity, to make sure that the decision that we make with regard to picking up a technology or an intervention specifically targets the more vulnerable. The father of the nation, Mahatma Gandhi, said that if you are faced with a dilemma in public decision-making, public policy decision, I'm not exactly quoting the words, but giving the essence, think about the person that you have seen in your life who was the poorest of the person that you ever saw. Look at the face of that individual. And then close your eyes and think whether the decision that we will take would help that person. Equity is at the heart of India's endeavor for development. And sir, ISHTA provides us a tool to make those decisions systematically in favor of the more vulnerable. ISHTA promotes equity, and is, in that sense, is a tool that promotes the essence of what the father of the nation said. Having said that, I would like to make two additional points. One, we need to strengthen our collaborations with our global fraternity. We still need to move the health technology assessment science to the next level. The highest possible level in ISHTA science is our aspiration, and here we need collaborations with our distinguished partners that on the global scene, and several of them are here. We're very warmly welcoming them. Second, our network must get further widened. It's a vast nation. We are 30 states, and we have to have footprint of the science of ISHTA in many, many more institutions and systems. Lastly, I like the team ISHTA to look at three areas, at the three paradigms to look at when we examine the interventions and technologies through the lens of ISHTA. One, telemedicine. eSanjeevani has provided care for more than 1 crore individuals. What is the impact of this? The world should know this story. People of India should know this story. The Parliament of India should know this. How much impact it is making, the science part. You're not making a choice for telemedicine, but we would like to know what difference it is making to the lives of people. How much out-of-pocket expense is being protected through a massive effort through telemedicine. That's my one request. We need to look at also specifically and selectively on the demand-side interventions. Typically, we are on the supply side, the tools that we put on the table. What about the demand-side intervention? What about care-seeking, preventive approaches, but also behavior change? The social aspect of health dimension must also be studied in order to make a stronger case for that. And that's very important in our journey to improve the primary health care and the overall health of the people and prevent illnesses. In the context of NCDs, prevention is of fundamental importance, and that journey is yet to start in full earnest. And last, we must also examine how we can identify affordable technologies, affordable interventions across the One Health spectrum. No more can only be focused on what we gain through human health. There will be interventions which also impact the entire spectrum of the One Health, which means the animal kingdom, the wildlife, environment, and human health. So this could be another frontier that we all work together. As chairperson of the ISHTA, I'm very honored to be a part of this strengthening the pillar of this pillar of our healthcare system, and I'm very honored to be here in the august presence of our Honorable Vice President. Thank you very much. Jai Hind.
Thank you for your remarks, Professor P.K. Paul, respected member Niti Aayog, Government of India. And ladies and gentlemen, may I now humbly request Honorable Minister of Health and Family Welfare and Chemicals and Fertilizers, Government of India, Dr. Mansukh Mandaviya ji, to kindly address the august gathering.
International Symposium on Health Technology Assessment के आज के सेमिनार में हमारे बीच में उपस्थित हमारे उपराष्ट्रपति जगदीप धनखड़ जी, आज के अवसर पर विशेष उपस्थित नीति आयोग के हमारे मेंबर डॉक्टर पॉल साहब, हमारे वीपी साहब के सेक्रेटरी सुनील गुप्ता जी, आईसीएमआर के डायरेक्टर राजीव बहल जी, सभी उपस्थित भाइयों एवं बहनों, मैं मानता हूं कि आज का ये सिंपोजियम एक ऐसे अवसर पर है जिसमें हर समय कुछ न कुछ डिमांड लेके आता है। देश ने आज़ादी का 75 इयर्स पूर्ण किया है और अभी हम अमृत काल में हैं। Not only for low and middle income countries, but all countries now and today it's need that। इस स्थिति और हमारी डिमांड है कि देश और दुनिया में हेल्थ केयर अफोर्डेबल हो, एक्सेसिबल हो और सभी को मिले, इक्विटेबल भी हो। और इसलिए हेल्थ असेसमेंट बहुत आवश्यक होता है। नया रिसर्च, नया इनोवेशन हमारे हेल्थ सेक्टर को कैसे स्ट्रॉन्ग कर सकता है, हेल्थ सेक्टर को कैसे मजबूत कर सकता है, उसका असेसमेंट होना, कोई नई टेक्नोलॉजी डेवलप हो, कॉस्ट इफेक्टिव है, क्या हम उसको पब्लिक हेल्थ के लिए उपयोग कर सकते हैं, सरकार के लिए कोई योजना पब्लिक हेल्थ के लिए चली हो, उसका क्या आउटपुट है, उसको कैसे हम बेहतर इंप्लीमेंट कर सके, उसके लिए हेल्थ असेसमेंट ये बहुत आवश्यक हो जाता है। और इंडिया जैसी कंट्री जो इमर्जिंग कंट्री हो, यहां नंबर ऑफ स्टार्टअप हो, नंबर ऑफ टाइप के इनोवेशन होता रहता है। ये इनोवेशन नॉट ओनली फॉर इंडिया, बिकॉज नो इंडिया इज ऑलवेज रिस्पॉन्सिबल टू ग्लोब। भारत ने कभी हेल्थ को केवल कॉमर्स के लिए नहीं देखा है। इंडिया के लिए हेल्थ ये अदर टाइप ऑफ सब्जेक्ट है, इंडिया के लिए हेल्थ ये सेवा है। और इसलिए इंडिया में जो रिसर्च इनोवेशन होता है उसका ग्लोबली यूज कैसे हो सके, जैसा इंडिया ने कोविन ऐप डेवलप किया तो हमने उसको पब्लिक गुड बना दिया, क्योंकि दुनिया उसका उपयोग करे, डेटा एनालाइज करे, मेटा डेटा डेवलप करे, मेटा डेटा में आर्टिफिशियल इंटेलिजेंस का उपयोग करते हुए हम ऐसे आउटपुट पर जाए जिसमें देश और दुनिया की हेल्थ सुनिश्चित हो। और इसलिए हेल्थ सेक्टर में समय के साथ बदलाव, समय के साथ डेटा एनालिसिस और डेटा एनालिसिस का उपयोग समय के साथ, भूतकाल में कोई सिस्टम होगी, उसकी सिस्टम अलग होगी, तो वर्तमान समय में रिसर्च और इनोवेशन कहां पर है, उसके मुताबिक डेटा एनालिसिस हम कैसे करते हैं। मैं मानता हूं कि उसका एक बहुत बड़ा महत्व होता है। और इस सिंपोजियम में मुझे जो इंफॉर्मेशन दी गई थी, 25 से अदर्स अबव कंट्रीज यहां प्रेजेंट्स है, सब आपस में टेक्नोलॉजी असेसमेंट के बारे में अपना विचार साझा करेंगे, आपस में बातचीत करेंगे, अपनी बेस्ट प्रैक्टिस को यहां रखेंगे। दोस्तों, हेल्थ कभी कोई कंट्री की अमानत नहीं होनी चाहिए। हेल्थ सभी के लिए होनी चाहिए। हेल्थ सेक्टर में सहयोग हिंदुस्तान अभी कभी उसको उपकार के रूप में नहीं देखते हैं, सपोर्ट के रूप में नहीं देखते हैं। इट इज अवर ड्यूटी, इट इज अवर रिस्पॉन्सिबिलिटी। हम उसको रिस्पॉन्सिबिलिटी के रूप में देखते हैं। हमारे पास जो कुछ है, बेस्ट है, हमारे कोई रिसर्च, हमारे कोई साइंटिस्ट ने कुछ इनोवेशन किया है, यूनिवर्सल उसका उपयोग हो, यूनिवर्सल उसका फायदा हो, और उसको भी एफोर्डेबिलिटी के साथ जोड़ के आज दुनिया में एफोर्डेबल मेडिसिन प्रोवाइडर कंट्री कोई है तो उसका नाम इंडिया है। आज दुनिया में 65% दुनिया की वैक्सीन की रिक्वायरमेंट पूरी करने वाली कोई कंट्री है तो इंडिया है। लेकिन हमने कभी एफोर्डेबिलिटी के साथ बार्गेनिंग नहीं किया है, समय के साथ भी हमने तालमेल किया है। ड्यूरिंग कोविड क्राइसिस जिस स्थिति दुनिया की थी, उस वक्त इंडिया ने रिस्पॉन्सिबल बिहेवियर किया। सारे डेवलप्ड कंट्री के पास भी इस समय में मेडिसिन नहीं थी। मुझे कई हेल्थ मिनिस्टर का कॉल आता था, बात करते थे। एक कंट्री ने मुझे बताया कि 15 डेज से हमारे पास एजिथ्रोमाइसिन नहीं है, प्लीज आप हमें एजिथ्रोमाइसिन भेजिए। और उस वक्त उन्होंने ये भी कहा कि हमारे पास वेंटिलेटर है, हम आपको देते हैं। तब मैंने कहा था कि आपके पास वेंटिलेटर है तो अवश्य इंडिया को भेजिए, हमारी रिक्वायरमेंट है, हमें जरूरत है। लेकिन हम आपके साथ बार्गेनिंग नहीं करेंगे कि आप हमें वेंटिलेटर भेजेंगे तो ही हम आपको मेडिसिन देंगे। जी नहीं, आप प्लेन भेजिए, इंडिया आपको मेडिसिन सप्लाई करेगा। 150 कंट्री में इंडिया ने मेडिसिन सप्लाई किया ड्यूरिंग कोविड क्राइसिस, बट इंपॉर्टेंट थिंग्स इज इट दैट इंडिया ने प्राइस हाइक नहीं किया। ये स्थिति थी, हम चाहते तो प्राइस ले सकते थे और दुनिया में वही प्रैक्टिस होती है, लेकिन मैंने जैसा कहा, हेल्थ कभी कॉमर्स नहीं हो सकता है। हमारा एथोस ने हमें नहीं सिखाया है। हमने 150 कंट्रीज में मेडिसिन सप्लाई किया, लेकिन प्राइस नहीं बढ़ाया, दूसरा क्वालिटी के साथ बार्गेनिंग नहीं किया। ड्यूरिंग कोविड क्राइसिस हमने भी कई एडजॉइंट इंपोर्ट किए थे, दुनिया से हमने भी कई चीजें इंपोर्ट की थी। हमें अनुभव भी अच्छा बुरा दोनों रहा। आज भी उसका विवाद चल रहा है, क्योंकि क्वालिटी के अनुसार सप्लाई नहीं थी, हमने उसको वापस भेजना पड़ा। दोस्तों, 150 कंट्री से और 83 कंट्री में हमने वैक्सीन सप्लाई किया। कहां से भी ये शिकायत नहीं आई है कि इंडियन मेडिसिन क्वालिटी मेडिसिन नहीं थी, इंडियन गुड्स क्वालिटी वाले नहीं थे। जिस चीजों का हमें इंपोर्ट करना पड़ता था, या तो इंपोर्ट प्रारंभिक स्टेज में हमें इंपोर्ट करना पड़ा, हुई कोविड क्राइसिस में यूज होने वाली चीजों का। कोविड जब हाइक पर था और उससे आगे बढ़ा, तब इंडिया एक्सपोर्टर बन गए, और वो भी अफोर्डेबल प्राइस के साथ। दोस्तों, यही भारत की विशेषता रही है। मैं मानता हूं कि हेल्थ टेक्नोलॉजी असेसमेंट के लिए बहुत आयामिक क्षेत्र में उसका उपयोग हुआ है, जो यहां बताया गया। आयुष्मान भारत योजना, उसका क्या इम्पैक्ट, हम यहां स्टार्टअप देख रहे थे। दोस्तों, स्टार्टअप यहां जो उपस्थित है, मेरा आपसे आग्रह है दोस्तों, नहीं केवल आप हेल्थ सेक्टर में स्टार्टअप लाके अर्थोपार्जन कर रहे हैं, या तो आपकी इंडस्ट्रीज के रूप में आप देश को और दुनिया को प्रोवाइड कर रहे हैं। जी नहीं, आप दुनिया की बहुत बड़ी सेवा कर रहे हैं। कई लोगों का जीवन बचाने के लिए आपकी टेक्नोलॉजी यूजफुल हो सकती है। दोस्तों, देश और दुनिया की सेवा करने की भी एक अपॉर्चुनिटी है। हेल्थ सेक्टर में जुड़े हुए सब लोग हेल्थ सेक्टर में जो भी कंट्रीब्यूशन करेंगे, दोस्तों, ये मानवता का कार्य है। इस दृष्टि से हिंदुस्तान उसको हमेशा देखता है। अमृत काल में मेरे हिंदुस्तान के स्टार्टअप मेक इन इंडिया के तहत, आत्मनिर्भर भारत के तहत, इंडिया के लिए तो कोई ना कोई असेसमेंट करके सुझाव देंगे ही देंगे, इंडिया का मॉडल बनेगा, लेकिन उसका यूज ग्लोबली हो। हम आजादी के अमृत काल में 25 साल में जब देश हिंदुस्तान आजादी का शताब्दी वर्ष मनाता हो, उस वक्त जिस गोल लेके प्रधानमंत्री जी ने हमें जिस गोल दिया है, हमें डेवलप्ड कंट्री बनना है, लेकिन डेवलप्ड कंट्री बनने की हिंदुस्तान की डिफिनेशन केवल शक्तिशाली नहीं होना है। हमें दुनिया के साथ सहयोग करके दुनिया के साथ हमारी क्षमता को साझा करना है। दुनिया के साथ हमें सहयोग करना है। क्या हम दुनिया को सहयोग कर सकते हैं इन हेल्थ सेक्टर में? स्टार्टअप के द्वारा हम हमारी शक्ति का यूटिलाइज करें, और ऐसे ही सिंपोजियम के द्वारा आपस में विचार विमर्श के साथ, म्यूचुअल कोऑपरेशन के द्वारा हम इंडिया और दुनिया का हेल्थ सेक्टर को स्ट्रॉन्ग करें। यही आप सबसे अपेक्षा है। धन्यवाद।
बहुत बहुत धन्यवाद माननीय केंद्रीय स्वास्थ्य एवं परिवार कल्याण मंत्री भारत सरकार डॉक्टर मनसुख मांडविया जी। Ladies and gentlemen, our Honorable Union Health and Family Welfare Minister, Dr. Mansukh Mandaviya ji. And may I now have the privilege of inviting our Honorable Vice President of India, and I sincerely request you, sir, to kindly grace us with your kind words. Please, sir.
My greetings to everyone present here. Dr. Mansukh Mandaviya ji, Honorable Union Minister of Health, Family Welfare, Chemicals and Fertilizers, Government of India. Let me, friends, indicate to you the name Mansukh. Those who are not familiar with Hindi, it is sublime happiness. And there can be no sublime happiness unless you are healthy. The right man and the right seat, accomplishing the right objectives. In his discourse, apart from other things, he reflected India's age-old wisdom, our ethos, our civilizational essence, that we don't treat health as commerce. Engaging in health sector is an opportunity to serve the humanity, but not to engage in commercial exploitation. He has rightly indicated it is service. And the underlying object is service limited not to your family, not to your country, but to the entire world. In our country, historically we have taken the world to be one village. And that, friends, is also the motto of G20, of which India presently is heading here. Sri Sunil Kumar Gupta, Secretary, Vice President of India, Dr. Rajiv Bahel, Secretary. He is also Director General, Indian Council of Medical Research. I heard him with rapt attention. How seamlessly he unfolded the strategy that is in action. And I can assure you, friends, this is the ground reality in the country. I'll come to it a little later. Professor V.K. Paul, Niti Aayog member, I don't have to say, he brings on the table innovative approach, how to tackle situations, how to motivate the sector, how to inspire it, and how to ensure that we get the best that can be available for health sector. Excellencies, our foreign delegates, various stakeholders, WHO representative to India, Dr. Roderico Offrin, and everyone present here. I would at the outset commend the organizers of this conference and how, if I go by the document given to me, 3 organs, Center, CCD has come together with the government, with WHO, World Health Organization. When I went through the sessions, I was really surprised. No one can improve on the agenda that has been set for deliberation and discussion. And it has been done in such a rational, methodical manner to bring about an ecosystem that will generate wellness of humanity. Session 1, friends, affordability of healthcare services, a very critical aspect. Keeping in view this affordability, our Prime Minister Narendra Modi ji came out with Ayushman Bharat, and that is the spinal impact adversely to a family, to friends, if you are taken ill or suffer from a deadly disease, that has to be contained. The world's largest, most transparent, accountable, impactful mechanism is benefiting 1.4 billion people in this country effectively. And this affordability, friends, has generated into evolution of a system that is not pyramidal. Pyramidal means there are some people who can afford. They can afford the best. It's not available everywhere. But the concept that the Honorable Minister has executed very successfully is a plateau kind of a development. Because of this Ayushman Bharat, we have in the country paramedical forces, we have diagnostic centers, we have growth of medical colleges, we have growth of nursing colleges, we have growth of clinics, and that has brought about a plateau kind of a development. So affordability. And this touches the lives of those who are fiscally vulnerable. If they have to suffer on the count of affordability, then growth of their children is impeded. The family's economy goes haywire. There is a great focus on affordability. I am sure the deliberations will give new dimension to it. When we come to second session, availability of healthcare technologies. Friends, technology is a game changer. Technology is a turning point. And if it is not available, then we have to go to various places. Let me give you a small illustration. In 1989, I became Member of Parliament. I was a Union Minister. 2 years before that, my father was taken ill. He suffered heart attack. I had a tough time, first in trying to secure angiogram. It was available selectively only in 2 cities. And I had to take him for treatment outside the country in the UK. Now, all this is available in this country at division level. Not in the state capital, at divisional level. And of the highest quality. So this availability is a game changer towards good health and happiness. Friends, we may afford, it may be available, but the third important subject on which you all will be deliberating is accessibility. I reflected on it a while ago. So accessibility to healthcare technologies. We have wellness centers, not in tier 2 cities, not in semi-urban areas, but even in the villages. And that is a milestone achievement, a significant development. And the fourth session, which will be taking care of all this together through ISHTA, and that is way forward stance, with collaborative efforts to enhance these segments. Now, what is more important? Any institution, the safest way to degenerate is to keep it away from accountability, keep it away from scrutiny, keep it away from assessment. In a sense, don't audit it. This International Symposium on Health Technology is assessment oriented. You will be critically assessing these situations, and that, I am sure, will go a long way in securing a world order of health and happiness. Let me share certain experiences with you, friends. When our Honorable Prime Minister assumed office in 2014, that was after a gap of 3 decades that the country came to have a single-party government. In 89-91, I was part of a government that was coalition of 24 parties. 2014, we had a single-party governance. And he, following the footsteps of father of the nation, Mahatma Gandhi, one fine day he went to a place and started a campaign, 2nd October, the birth anniversary of father of the nation, Swachh Bharat Abhiyan. Some people thought, what is he doing? Prime Minister of the largest democracy, mother of democracy, has taken to cleaning. And friends, this has changed the landscape of Bharat. Consequently, what we never thought or imagined, every household is having a toilet. What we never thought or imagined, we are on way to getting fresh potable water at home. And side effects are such that there has been industrial growth, startups, entrepreneurship has grown. This is generating mass movement for securing health and happiness of the people at large. I was Governor State of West Bengal, and that was the time the world was visited with pandemic, non-discriminatory, adversely impacted all, high and mighty, rich and poor, countries, irrespective of geographical location. It impacted. India's handling of COVID exemplifies the best practices beyond doubt now. I remember the day when, as governor, it was flashed to me that the Honorable Prime Minister of the country has called for people's curfew. Curfew is normally taken to be by legal regime, by state actor. But to combat COVID, to inspire and motivate people, the leader of the largest democracy gave a call, people's curfew. And then people learned the art. You will have to maintain curfew so that what was advised to contain COVID could be translated into action. It was done very successfully. It was equally enlightening to me when we got a flashed news that the Honorable Prime Minister will be there to cheer the COVID warriors. And what we do traditionally, we will take and ghanti bajayenge. We did it because COVID warriors were those who were prepared to lay down their lives to save the lives of people at large. And we were quick in the country to come out with a legislation so that full protection is afforded to them. Third, we lighted lamps to honor them. With his vision, he advocated hand-holding. It doesn't matter you give succor to whom. Number doesn't matter. Your intent matters. One who could feed 100,000 people was as good as one who could feed 100 people. That is something I have seen myself in that position. In that perspective, when I have gone abroad on 2 visits, how satisfying for me it was to note that when India was facing COVID, India could innovatively have vaccines. India could vaccinate 220 crore people and put it on digital mapping. It was also giving assistance to other countries, vaccine metri. And that is something reflective of our age-old ethos. Pehla sukh, nirogi kaya. The first concept of happiness is we must be healthy. Friends, I do not wish to take more because much has been said. But what I have seen, 1.5 lakh health and wellness centers, they have come up in the country. They are functional. And the technological upgradation is taking place. This is generating huge opportunities for entrepreneurs, for skilled human force. It's turning out to be a great game changer for economic growth also. Over 33.8 crore Ayushman Bharat health accounts. And there are 50 crore beneficiaries of Pradhan Mantri Jan Arogya Yojana. Now these numbers to the world at large may be staggering. But in our country, the development is proportionally manageable. It is being done in a very structured manner, not in isolated instances or otherwise. Affordability of medicine to the ordinary man is of critical consequence. This has been done in a very organized, well spread out geographically. Centers, 9,000 Jan Aushadhi Kendras. Friends, cancer is a deadly disease. And what has been done in that area is amazing. By providing of medicines that are affordable. On an estimate, 200 crore per annum is a saving to cancer patients by the proactive, affirmative steps taken by the Honorable Minister. And himself monitoring at micro level. Technology has been used. You don't have to physically negotiate in this country to secure assistance. India is an example in the world where we have used technology for making available efficient service to the people. There was a time when I was a student or even a member of parliament. There used to be long queues to deal with your payment of bills. There used to be physical transactions of money. No longer. But in the health sector, a revolutionary thing has been done. And over 8 crore, 80 million teleconsultations have been conducted through eSanjeevani. The National Telemedicine Service of India. And friends, this is catching up at geometrical level. This is turning out to be two-way aspect. Because if you get the right consultation, if you get the right diagnostic report, treatment is easy. I have seen in my country, our Bharat, TB, tuberculosis, was a sure killer in 50s and 60s. But now, if you go to even a chemist shop, a patient says, I have TB. By robust common sense, well-known mechanism, the chemist shop may give you 9 months treatment. There's a qualitative jump in these things. Nothing can happen unless you focus on educational growth. We used to have tough competition for boys and girls to be admitted to MBBS, to postgraduate courses. I compliment the Honorable Minister for having imagined and executed. And the number of seats in graduate, postgraduate have been doubled. Friends, I don't wish to take more. All I'm saying is, if India is on the rise at the moment, as never before, and rise of this country is unstoppable, is going to be geometrical further. This is on 2 great concepts. And those 2 great concepts were highlighted by our visionary Prime Minister in last year and a half. One, he gave a message to the world. We are not in an era of expansion. Expansion by nature is invasive action. Expansion by nature is compromising somebody else's sovereignty. Historically, this country has never engaged in expansion. And second, he indicated to the world at large, setting a global discourse which is catching up. War is no solution to any problem. And both these 2 things I have indicated play havoc if they visit us on our health, on our happiness. So I would urge everyone here present, all stakeholders, World Health Organization, and leaders, if we have to make this world healthy and happy, we have to subscribe to an ecosystem. And friends, in all modesty I can say, this country, Bharat, has evolved this ecosystem over thousands of years, and that is Vasudhaiva Kutumbakam. World is one family. Let us believe in that, and let us work to handhold each other to the best of our capacity to contribute to each other's good health, happiness, satisfaction. And in conclusion, I'll say, certain things are being created by us, like mental disorders, stressful working, tension all around in the workplace. We are in competitive mode throughout. I quite often tell people that I was throughout a gold medalist #1 in my class. I always suffered the tension and stress What will happen if I don't come at number 1? I share it with you all, friends. Nothing would have happened. I would have had a little more time to interact with people, make them happy, handhold them. So let us develop this mechanism. Let us disseminate, enlighten, and work so that we reduce the tension of the people. We bring down the stress level. We cut down what has come to be known in highly urbanized areas as lifestyle diseases. That lifestyle is not worth it. I am grateful for giving me this great opportunity, particularly to the Honorable Minister, whom I admire for a simple reason. He has out-of-the-box approach and solution to problems, and in a low-profile manner secures their execution, and is never in a mode of reaction. Thank you so much.
Thank you, Honorable Vice President, sir, for enlightening us, for guiding us. You always inspire us, we all know that. And now to deliver a word of thanks, may I invite respected Dr. Sangam Mitrapati, Director, RMRC Bhubaneswar.
Honorable Chief Guest, Honorable Vice President of India, Sri Jagdeep Dhankhar ji, Honorable Guest of Honor, our own Union Minister, Health and Family Welfare, Minister of Chemicals and Fertilizer, Dr. Mansukh Mandaviya ji, respected Professor Vinod Pal ji, Sri S.K. Gupta ji, our DG Rajiv Bahel ji, distinguished delegates from the country, outside the country, and all the august audience. I feel honored and privileged to get the opportunity to propose a vote of thanks on this momentous occasion in the annals of the history of health technology assessment in India, as well as Atmanirbhar Bharat. On behalf of the Department of Health Research, we extend our heartfelt gratitude to our Honorable Vice President of India, Sri Jagdeep Dhankhar ji, for his august presence and inspiring thoughts shared at today's symposium. Sir, on behalf of everyone, we offer our profound gratitude with folded hands. Sir. We express our heartfelt gratitude to our mentor and guide, Honorable Union Minister, Health and Family Welfare, and Minister of Chemicals and Fertilizers, Dr. Mansukh Mandaviya ji, for his exemplary leadership towards catalyzing the Health Technology Assessment in India program of Government of India. Sir has been a true visionary and pioneered the affordable medicines a reality across the country. Not only that, Sir's visions towards making affordable technologies at the same time making it quality like heart stents and knee implants accessible to every common man in the country. Sir, on behalf of everyone, we offer our profound gratitude to you. We are deeply grateful to the insightful guidance provided by Professor Vinod Pal sir, Chairman of Medical Technology Assessment Board and member Niti Aayog, not only for attending today's event, but also for his inspiring guidance throughout. Sir, we thank you profoundly. We express our deep gratitude to Sri Sunil Kumar Gupta ji, Secretary to the Honorable Vice President of India, and we express our gratitude to you, sir, for your presence. We are deeply grateful to our own DG, our own mentor, our team leader, DG and as well as Secretary DHR, Dr. Rajiv Bahel ji, for guiding us throughout. At the same time, we do thank our previous DG, Dr. Balram Bhargav ji, for being here, sir. Thank you, sir. Both our present DG and previous DG has contributed tremendously to spearhead this Health Technology Assessment of India program. We also thank all the excellencies from different countries. His Excellency High Commissioner Republic of Gambia, Her Excellency High Commissioner Seychelles, His Excellency Ambassador State of Eritrea, His Excellency High Commissioner of Kingdom of Lesotho, His Excellency from Republic of Burundi, and His Excellency Togo for participating in today's event and reaffirming our age-old ethos of Vasudhaiva Kutumbakam, one earth, one family. Together, we can make it happen. We want to thank all the international delegates and WHO India representative and all the distinguished guests who have made this occasion more special by their presence. Special thanks goes to our team leader, Madam Anu Nagarji, Joint Secretary DHR, and her able Health Technology Assessment India team for working relentlessly and making this event a successful one. We do thank members of print media and electronic media for their encouraging presence. I am sure all of us will greatly benefit from different deliberations, differentiations of today's event, but this symposium took enormous time, and each one of them who has worked and put their best efforts to make this symposium happen and fruitful. The wheels began rolling many months ago when the symposium was announced. Since then, everyone has put tremendous efforts in making this a cohesive, a concerted symposium. So each one of those who have visibly and invisibly contributed to this symposium deserve all our thanks. Having said that, the ISHTA Symposium is the brilliant embodiment of research, innovation, policy, and practice. Towards this, we are immensely grateful to all our ISHTA India resource hubs, our technical partners, all our industry partners, and most importantly, our state government counterparts, whose acceptance and adoption of our product will go a long way in fulfilling our Honorable Prime Minister's vision of true Jan Bhagidari. I once again thank each one of you for your presence. Jai Hind, Jai Vigyan, Jai Anusandhan. Namaskar.
Thank you, Dr. Sangamitra Patiji, for a word of thanks. And now, ladies and gentlemen, may I request you all to kindly rise for the national anthem. With this, ladies and gentlemen, we sum up our first session, that is our inaugural session, and we would like to thank all our dignitaries on the dais. May I request you all to kindly remain seated until our Honorable Vice President Sir leaves the hall. Thank you. So, ladies and gentlemen, on the other side of the session, we have our first technical session on affordability of healthcare services, sharing